So quickly look at the definition of myelodysplastic syndrome. When you actually talk about myelodysplastic syndrome, there's a definition and overview that I should give. We have it in this lecture. I'll be looking at the FAB classification. What is FAB? FAB is the French American British classification, right? So this organization actually classifies some diseases, and for some diseases, their classification is actually seen as a standard. Okay, so we'll look at the FAB classification of what? Myelodysplastic syndrome. Okay, so we see myelodysplastic syndromes. This one affects all age, right? But it's more common after the age of 60, right? So let's look at the definition. Look at the definition. Myelodysplastic syndrome is actually a group of disorder that is caused when something disrupts the production of red blood cells. Okay, the red blood of blood cells in general, not only red blood cells. Okay, so blood cells are supposed to be formed from hematopoietic stem cells. So if anything is stopping the formation of these red blood cells, white blood cells or platelets, that's what we call a myelodysplastic syndrome. Is either it's stopping it, yeah, most of the time just stop it a bit, okay, because once you don't have a zero production of blood cells, then you are dead already. Okay, so that's like something is hindering. There's still production though, but not optimal or not optimal. Do you understand? So some types of this myelodysplastic syndrome have no cause. Others occur in response to cancer treatments or chemical exposure. All right. So symptoms of this myelodysplastic syndrome include shortness of breath, fatigue. The individual have easy bruising. That is, you'll be having wounds easily, and you'll be having paleness. Okay. So myelodysplastic syndromes may progress to leukemia as cancers of blood. All right. Transfusions and medications help to manage symptoms of myelodysplastic syndrome. Medications or bone marrow transplants may lessen transfusion needs and slow or prevent progression to leukemia, right? So myelodysplastic syndrome. Basically what? Something is kind of like reducing how the blood cells were being produced before. So it is a heterogeneous group of disease characterized by what? Myelodysplasia, ineffective erythropoiesis, and a tendency of evolution to leukemia. All right. So there is also what? Thrombocytopenia, that's reduced platelets. There's hepatosplenomegaly, that's increase in what? Liver and increase in the size of spleen. All right. And there's also what? Lymphadenopathy. Right. Some lymph nodes will actually what? Get so large. Right. So talking about the FAB classification of myelodysplastic syndrome now, right? We have the refractory what? Anemia, right? Refractory anemia. This one is affecting like just like 1% of the blood, okay? Then it's affecting like 5% of the bone of the blood marrow, okay? So next we have what? The refractory anemia with ring sideroblast. You could just take the classification like this without all these percentages, all right? Because of a truth, I don't really even know what the percentages stand for, okay? So I think you could just take up the names like this, right? Without all those percentages and all that. That's just trying to complicate the whole thing. We have refractory anemia with ring sideroblast. We have refractory anemia with excessive blood. We have refractory anemia with defects in transfusion. Then we have the chronic myelomonocytic leukemia. So I haven't watched all these videos. If you need a further video on any of these classifications or even all the classifications, talking about them in depth, you just let me know, all right? Because this one just listed it for exam sake, right? That's it about what? Myelodysplastic syndrome and its classification, right?